Good day, everyone. Hoping that you have an amazing day today. In this video, we're gonna discussing about motor neuron disease. MND or motor neuron disease is a group of conditions that cause the nerves in the spine and brain to progressively lose function. They are rare but serious and incurable form of progressive neurodegeneration. There are 5 types of MNDs: amyotrophic lateral sclerosis, progressive bulbar palsy, progressive muscular atrophy, primary lateral sclerosis, and spinal muscular atrophy. ALS, or most commonly known as Lou Gehrig disease, is the common type, affecting muscles of the arms, legs, mouth, and respiratory system. Mean survival time is 3 to 5 years, but some people live up to 10 years with supportive care. PBP. It involves the brainstem. People with ALS often have PBP too. The condition causes frequent choking spells, difficulty speaking, eating, and swallowing. Progressive muscular atrophy slowly but progressively causes muscle wasting, especially in the arms, legs, and mouth. It may be a variation of ALS. Primary lateral sclerosis is a rare form of MND that advances more slowly than ALS. It is not fatal, but it can affect the quality of life. In children, it is known as juvenile primary lateral sclerosis. Spinal muscular atrophy is an inherited MND that affects children. There are 3 types, all caused by an abnormal gene known as SME1. It tends to affect the trunk, legs, arms. Long-term outlook varies according to type. Some MNDs are inherited while others happen randomly. The exact causes are unclear, but the NINDS notes that genetic, toxic, viral, and other environmental factors likely play a role. MND can be divided into 3 stages: early, middle, and advanced. There are 3 common areas at early stage: the arms, legs, the mouth, or the respiratory system. They garbled in speech, trouble breathing, fatigue, muscle pains, and difficult swallowing. As the condition progresses, symptoms become more severe. Muscle pains increase, stiff limb muscles, drooling, and joint pain grows. At the advanced stage, complications of the respiratory system are the most common causes of death. The patient will be unable to move, eat, or breathe without assistance. MND is incurable, so treatments focus on slowing the progression and maximizing patients' independence and comfort. This can include the use of breathing, feeding, mobility, and communication appliances and devices. Rehabilitation therapy may include physical, occupational, and speech therapy. Oh, wait a minute.
Stephen Hawking is one of the survivors of motor neuron disease. He was diagnosed with ALS when he was 21 years old.
What do you know about Stephen Hawking?
He's famous with Big Bang Theory.
Yes, brilliant. And he was published almost 200 papers and books, and was invited to almost 65 TV shows.
So I heard that he lived for almost 55 years. And but what made him an outlier of all?
Yes, you are correct. He just died this early 2018, and actually doctors and researchers can't really know why is the reason that he could be able to live for a long time. However, they believe that different people diagnosed with this disease have different high variability, which means some can live longer while some don't.
Last question, how did he prolong his life?
By the late 1960s, he was using a wheelchair to move around and was having trouble writing. His speech began to deteriorate in the 1970s. From then on, he spoke through his computer system, which he operated with his cheek. And this form of neurodegenerative disease that determined on how long he survived.